What's up, Navigating Academia family? This is your buddy and personal academic mentor, Dr. J. Phoenix Singh, coming at you to be able to respond to a video that was shared with me. No joke, I was either at like the end of my undergraduate years or when I was at Oxford doing my first doctorate. And I just thought it was hilarious because it was like brutal. It was brutally blunt and so funny because a lot of the things that we talk about on this channel or whatever is kind of talked about in this video as well. You know, if you want to go into clinical psychology and become a clinician, or if you want to be a social worker and be, let's say, a licensed clinical social worker or a counselor and become a certified mental health counselor, whatever it happens to be clinically, you have to go into those degrees with your eyes wide open. It's like super important, especially with a doctorate in clinical psych. I remember having a session a few months ago with one of you where both of your parents were medical doctors, and you're telling me that, well, I'm clearly going to be making a lot of money. I mean, I'm going to be a doctor after all. And it was almost like a pre-con conclusion that you were going to be essentially rich. I mean, making high six figures, just like your parents who were medical doctors in the United States. And this just isn't the case. And we talk about all the time that you should take a look at whatever your nation's version of, in the U.S., what Bureau of Labor Statistics is, to be able to get a sense of exactly how much money you're likely to make in your career field and in your state or in your province or in your region. Usually with some very simple Googling, you can get a general sense of, how much money people are making, both in terms of the median as well as the average. So this was just this brutal thing that was made here in cartoon form, and honestly, I still think it's hilarious. I thought it was hilarious. I was already in academia when I saw this. And so anyway, I'll stop, give you guys some commentary, but let's go ahead and get started.
Hello, Professor. I would like to talk about my future. I want to be like you and get a PhD in clinical psychology.
Why do you want a PhD in clinical psychology?
My friends say that I give really good advice and I like to help people and tell them what they are doing wrong.
Okay, I hear this a lot, right? By the way, even though this just happens to be a Caucasian girl, right, or woman rather, this could be anyone of any ethnicity or race or gender identity or sexual orientation or any of the above, or sex, any of the above, right? So this just happens to be who the avatar is here. But oftentimes people have really wonderful intentions and they say to me, Dr. Singh, I just really want to help people. And ever since I was a kid, all my friends came to me for advice and they always thought that I gave really great advice. And so that's why I want to be a psychologist. And don't forget that on this channel, I say all the time, you do not need to be a psychologist or a social worker or a counselor or a nurse in order to help other people with mental health problems. And I always go back to Carl Rogers' seminal research where, to make a very long story short, he took individuals basically off the street who were, had no behavioral health training, and then he had people who were doctors and basically had them both behavioral health doctors, and had them both essentially just have mock sessions with real clients, and then had those real clients say, hey, who did you get help more by? And there was a non-statistically significant difference between them just by active listening, by reflecting back what a person is feeling, being empathic and so forth, i.e. being a good friend to your friends, or by volunteering and being a community member who maybe works for a crisis text line or for a hotline for domestic violence survivors, you name it. You can do so much good in the world without having to get one of these licensed degrees, right?
You can still give advice and tell people what they are doing wrong without a PhD in clinical psychology.
I want a PhD. I think it's cool that people will call me doctor.
Who will call you doctor?
My patients will call me doctor.
Your patients will call you by your first name and will not even know that you have a PhD. They will be confused that you are a doctor who cannot prescribe them psychiatric medication.
That definitely does happen in terms of people getting confused, and frankly, one thing I talk about all the time is that people aren't going to care about the letters after your name. They're going to care about whether or not you are actually clinically skilled, and the overwhelming preponderance of your clinical skill is not going to come from what you learn in graduate school. It's going to provide you a lot of foundational information and a wonderful toolkit of skills to be able to start out, but you really need to get out there, be in clinical practice, right? Your experience over the years is really what's going to ground grant you that knowledge that's going to significantly help you basically build your career and build your practice, or simply make you a more valuable team member if you're not in private practice, but you're working in a hospital or clinic or any other sort of setting, okay? Let's put it this way, when it comes to getting called doctor by patients, in some cases, that happens, and in some cases it doesn't. Indeed, like this little cartoon professor is saying, you go by the first name.
My friends will call me doctor.
Your friends will laugh at you if you ask them to call you doctor.
My family will be proud of me and call me doctor.
Your mother will cry and ask you why you did not become a real doctor.
I need to feel proud of myself, and I will call myself doctor.
If you need a PhD to be proud of yourself, you should go to a therapist because you have low self-esteem.
Okay, that's brutal. I do think that if you want to go to grad school and get a doctorate just because you think that it'll make you more proud of yourself, that is a sign of low self-esteem. I'm a huge believer in therapy for everyone, literally. Everybody has issues. Everybody has a traumatic past of some sort, even just a little bit. And even if you're not trying to get over anything negative, therapy can still be something that's very elucidating for your life and for your character and these sorts of things, right? It is true that your family is not going to call you doctor unless it's one of two things. Number one will be the day when you hopefully have, the day where you get hooded or whatever it happens to be for you, your graduation ceremony, and they'll be like, "Hey, Dr. Singh," and then after that it'll be anytime you do anything stupid, anytime. Right? So, for example, if you forget your passport on the way to the airport, they'll be like, "Hey, Dr. Singh, are you kidding me right now?" Okay, those are the two times really that your family's going to call you doctor. Your friends, it would be really weird. Like I said, they'll laugh at you or whatever. No, your parents are not going to cry or anything like this. They're just joking about, not becoming a real doctor. In this case, they mean a medical doctor. I have a lot of medical doctors in my family, and, my running joke is basically if somebody's choking on a plane, then, I need my cousin Anshul to be able to help him out because she's a medical doctor. But all the trauma that everybody else has, from seeing that choking incident occur, okay, I can help with that, right? So that's what I say in terms of being a doctor.
Seeing a therapist will also be cheaper than going to graduate school.
As a clinical psychologist, I will make a lot of money in private practice. I will also make more money than therapists with their master's degrees.
You will have to spend your money on office space, malpractice insurance, licensure fees, continuing education credits, advertising, dues to the American Psychological Association, dues to your state psychological association, and dues to your county psychological association. You will also have to pay your student loans. You will have $100,000 more in loans than a therapist with their master's degree and only make $10 more an hour. Calculating your student loans, student loan interest, and delay in beginning your career as compared to someone with their master's degree, you will actually make $15 less an hour.
I will just see more patients.
Okay, so I don't know about that whole idea about only making $10 more an hour. I would say you will end up making anywhere. It totally depends on the region and the country and these sorts of things. In my experience, you will end up making anywhere between $20 to $40 more an hour. That is what I've personally seen. That is anecdotal, though. That's not statistical, but I'm just giving you guys my my background on that. But I do think that there's the point to be made that if you end up taking on very significantly more student loans to be able to do a doctorate rather than a master's, and obviously, that debt can grow and grow and grow, and I do not under any circumstances in the U.S. believe that you should count on any of your student loan debt being canceled. I do not believe in that whatsoever, and including whatever that program is where if you work for X number of years in social services or for the government or something like this, that it'll be forgiven. If you actually look at the data, less than 3% of all applications that have been put in from eligible individuals, those less than 3% have actually gotten their money. So do not trust that. I have very dear friends of mine who have done that. They're still waiting. They literally have almost $400,000 of student loan debt, right? And it didn't start like that. It started about 250, right? But the interest has kept going up because they're just well, we're just gonna, pay the very minimum and these sorts of things. And yes, the interest or whatever will kind of, take a bite out of things. But, at the end of the day, it's going to get forgiven. And then it doesn't. It's not a sound plan, okay?
So I can pay my higher student loans and one day buy my dream house.
Your student loan payments are based upon a percentage of your current income, so the more money you make, the more you will have to pay back every month. You will not be able to buy your dream house because you will have student loans the size of a mortgage.
Okay. Well, I would say that that's possible, that you wouldn't be able to afford a dream house, but it depends what your dream house is, to be honest with you. And it depends how much money you make from, not just from your primary income, but side income as well. If you can get jobs in terms of consultations or paid trainings and these things. But just remember that for those things, there are incumbents who've been doing it for 20 to 40 years. And those people are going to get chosen before you. And that makes sense. When you're 20 to 40 years down the line and you're getting those positions, are you really going to want somebody who's like late 20s, early 30s to be able to get them over you? I think not, right? And for understandable reasons. So,
With a PhD in clinical psychology, I can also be a professor like you.
Yes, then you can teach Introduction to Psychology. You could probably teach that class now as a senior psychology major.
You also teach abnormal psychology.
Yes, I get to hear students tell me about their mental disorders and why what I am teaching them about the mental disorders based upon my 10 years of experience is wrong because what I am saying does not accurately describe the mental disorder that they think they have because they saw it on a cable television show.
okay, that has happened to me before. Okay, so that's true.
Do you like working with your colleagues in the psychology department?
They are okay, but when you are a clinical psychologist, people think that you are crazy, so you have to always be extra nice so that people don't think that you are crazy.
Okay, that's not true. When you're a clinical psychologist, people do think that you're analyzing them all the time. So that's certainly something that's not true. But take that for what it's worth.